Hello, my name is Prashant Kedia, the Director of Interventional Endoscopy at Methodist Dallas Medical Center. I'm here to discuss with you a new technology that we're actually performing now called EUS-guided portal pressure gradient measurements. And what this is, it's a technology that allows us to measure portal pressures or vascular pressures in patients with liver disease. And this is really an exciting technology because as you know, liver disease is quite common, and it's a rapidly growing phenomenon in our country, especially with obesity and fatty liver. And often these patients are being managed by hepatologists and transplant institutions that require certain kind of measurements of their liver in terms of biopsies and portal pressure gradients to understand what therapies they can receive and also what the stage of their liver disease is behaving like at the moment. In the past, the only way to get these kind of portal pressure gradients was through an interventional radiologist, where they would have to access a vein in the neck and travel down to the liver and some of the vessels down there to get some readings on these blood vessels. But now, with this new technology and the specialized needle that's been developed by Cook Medical, we are able to access these vessels in the liver using an endoscopic ultrasound scope and measure these pressures directly. So this is very exciting because it really allows us to do a minimally invasive procedure endoscopically to assess the liver, the morphology, even get biopsies of the liver, and at the same time now give the hepatologist or our transplant surgeons or surgeons the additional information they want to know about the vascular behavior of the portal vasculature. And this has a lot of implications over time in terms of our ability to be involved with endohepatology and management of liver disease in these patients and such. Other benefits also include the fact that it may be safer in some patients to do access of these vessels from inside the body as opposed to a vein in the neck, because there can be issues with bleeding and whatnot when you're trying to access these veins. So I think there's a lot of benefits to this technology going forward, and it's quite exciting for us. I think we were the first to actually get to use this needle in a live patient in Dallas, and it was a very successful procedure. We were able to get the measurements and hopefully help this patient in terms of their management going forward. So it's very exciting to be able to offer this to the patient and have a good outcome. And we're going to be studying this kind of technology going forward. So very happy to present this information to you. Definitely reach out to your regional advanced endoscopists about this technology, because I think over time more and more endoscopists will be performing evaluation of the liver using EUS. So thank you.